So let's talk about the antihistamine options available to you from your local pharmacy. So antihistamines are traditionally associated with hay fever, but are very good at stopping things that make you itch. So if you've been bitten by a mosquito, by an ant, or some kind of bush or something's causing you to itch, this is the stuff to use. Now obviously Claritine and Aries are very similar, they're in the same family. Aries has an advantage, you can start using that from 6 months for kids. It comes in a yummy bubblegum flavour. Telfast 180 is obviously technically one of the stronger ones. Again, it's very hard to compare. You can't compare 10 milligrams of this stuff with 180 milligrams of this stuff. It is not 18 times stronger. It is obviously just a different drug structure altogether, so we can't compare apples with bananas really. Telfast obviously comes in a liquid as well. Most of the time with the liquids for the kids, I will pick based on flavour. All antihistamines will work very similar. Some people will come in and say Telfast is the best thing ever. The next person may say it's a sugar tablet. Again, it's across the board with all of them. Zyrtec is the only one that can cause a little bit of drowsiness that we can see here. There's about a 10 to 15% chance of becoming drowsy on Zyrtec, so it's not everybody. Again, there are some S3 antihistamines that can be used. One of those in particular can be used during pregnancy. All the rest of these guys have not been proven to be 100% safe during pregnancy. So if you're pregnant, have a chat to your pharmacist about the best option if you are allergic to something. The only problem with those guys is they can cause drowsiness, so be aware of that. Not many options for doctors to prescribe. They would be looking at something completely different if you are having an allergic reaction. But if these guys aren't working and you're having an allergic reaction to something, it is best to see your doctor. Again, they can help settle things down with something a little bit different that obviously I can't mention. But in general, if you have an itch, you have a runny nose, itchy watery eyes, anything that is resembling hay fever or any kind of hives, get down to your local pharmacy, have a chat to them about the best treatment option for you in the antihistamine range. So if you've been bit by something and you're not quite sure what it is, as long as it's not too deadly like a snake, a shark or a crocodile, grab an antihistamine and take one as soon as you can. Get a permanent marker, draw a circle around the red area. Now keep an eye on that over the next 24 hours. If it comes back from that line, the antihistamine is doing its job, so keep taking that for the next few days. If it doesn't come back from the line, or it's aggressively passing over the line, or you're feeling nauseous, sick and faint, it's worth seeing your doctor or hospital as soon as possible.